Picture the scenario. You or someone you know is given a clean bill of health by the doctor. And within a few days, sadly, there is a significant cardiac event, a heart attack. This is not an uncommon scenario. And we want to talk as three doctors about this particular topic, why it happens, why the rates of heart attacks are increasing across the Western world, and what anybody can do to protect themselves and a loved one from this horrible event occurring. And for anybody who enjoys our discussions, please check in the links down below for our separate, unique Doctors of Fohi channel, where we post a lot of content, all related to your health and well-being. Dr. Peter, as our cardiologist, this is one that you have to start with then. Sudden heart attacks in people who are given a clean bill of health a few days earlier by their doctor.
Yes, very, very good topic and very important and very strong to me as a physician. Let me start by telling a story. And I think that really a lot of people out there can relate to this because they may know someone that this has happened to. But this past year, I saw a patient that really, by all means, was healthy, mid-60s, had really no strong family history, really nothing that struck me as being really a big red flag for someone that would be really ill. And this patient came to me and he was feeling short of breath. And this patient really had gone through a number of tests. He's had chest x-rays that were clear to work up the shortness of breath he was having. He had a visit with a lung doctor or a pulmonologist, which really got a clean bill of health. And I saw the patient and I really went through a lot of things. And the patient had a stress test and went on to have a nuclear stress test, which is a more involved stress test where you can look at blood flow around the heart, had an echocardiogram or an ultrasound of the heart. And really, by all means of the testing, everything came back normal. And there was some reassurance with the patient, but he still continued to have symptoms. Nothing really alarming, nothing overwhelming, but he just felt off. And fast forward a few months later, after getting a clean bill of health and felt reassured, patient was walking on the beach with his wife. His symptoms changed and then boom. Unfortunately, this patient cardiac arrested, out of hospital cardiac arrest, where we know that the survival rate is as low as 10%. Fortunately, he was able to be resuscitated and to be able to talk about what happened. And I think this is what I'm trying to drive, and we're going to drive home in this podcast today, is that a clean bill of health is really misleading. Nothing is 100% in medicine. And you can be told that everything is normal, but things can still happen. Like this is an extreme example, but it's the reality of it. There's a false sense of security in people having normal testing.
Yeah, that's a very profound story. Cardiac arrest suddenly on a beach. Would you like to speak briefly, because it's important to get this distinguishment, as it were, in terms, the difference between a heart attack and a cardiac arrest? Do they often overlap?
Sure, a lot of times they'll overlap, and really the final common pathway is a blocked artery. So the plumbing around your heart, there's one artery that gets severely blocked, or in this case, 100% blocked. That stops blood flow to part of the heart muscle, and that triggers these fatal heart rhythms, such as ventricular tachycardia or ventricular fibrillation. And the ultimate common pathway of both is cardiac arrest. A heart attack, not too different. People have different forms. Sometimes they don't have a complete blockage of an artery. It could be 80 to 90%, and they don't have a cardiac arrest and can present similarly. But a cardiac arrest is probably the ultimate or the worst outcome of all this.
I see. Well, yeah. And we all have stories to tell. We've all heard these stories as doctors, and this is why it's so important and what we want to impart on you. And by the way, please do comment down below if you have similar stories where a clean bill of health has been given by a doctor. The test has come back normal, but something has happened within a short space of time. And you would think nowadays that tests are very accurate and they would pick things up, but they sadly don't, because there's often warning signs. And this is why it's so important to know your own body. If your body's speaking to you and telling you something is wrong, Dr. Ben, as a primary care doctor, you must hear these stories all the time.
All the time. So I've heard a few of these stories. One's actually about a doctor that I can tell you about. So we had a psychiatry colleague who saw their primary care doctor and told them, "Hey, I'm having these awful panic attacks. I'm just having these horrible feelings of chest tightness." And being a psychiatrist, maybe that influenced this person's decision. They said, "These are panic attacks. I can't believe how bad these have gotten." A few days later, massive heart attack. It turned out these were the signs, the warning signs that a heart attack was coming. And I think probably because of this person's profession, they were kind of skewed toward what they had learned about. But again, it wasn't picked up at the doctor's visit. And then I have another story where there was a woman in her 60s, and I've told this story before, but got a clean bill of health by the physician she saw a few months prior and went into the ER with these feelings of sore throat. She was describing a sore throat when she was walking. And she said, every time I'm walking, I get this weird sore throat. Everyone was assuming this was some kind of viral infection. Came into the emergency room, and I've said before, the astute emergency room physician said, that doesn't sound right. Now, tests came back normal, but this doctor admitted them, and it turned out had horrible heart disease, needed bypass surgery. Big heart disease, at risk for a very tragic event. And that almost was missed as well. So this stuff happens all the time, really often.
It really does. And it's so important to understand. A lot of you watching, we know, are very tuned in. So you're probably familiar with some of the tests, like an EKG called an ECG in the United Kingdom and Europe. So a baseline heart tracing. Maybe you've had a heart ultrasound scan, which is an echocardiogram. You may have had a stress test done. Or you may have had some blood tests and be told everything looks good. Your HbA1c is normal. We'll talk a little bit shortly about inflammation and insulin resistance. But Dr. Peter, I think it's really important for all of our fine viewers watching to understand why, when, say, an EKG is normal or an echocardiogram is normal, even a stress test is normal, why can there still be a significant issue with the heart? And what should anybody know for themselves or their loved one to protect themselves?
Sure. I'd love to talk about that. I think what I see a lot is that people have stress tests, and there's really a false sense of security when patients have a stress test and they're said it's normal. And I think people just assume that there is a warranty behind that, right? And I think that people think that, well, I'm good and I can do, whatever I want. And so really what happens, and when I talk about the heart as a whole, is just, picture the heart like a house. So you have three different parts. You have the plumbing, the rooms and the doors, and the electrical wiring. So with regards to the plumbing on the heart, you have three big main arteries. And just like pipes in a house, over time, they can have sludge in them, but the water still flows really nicely through those pipes. And the same with the heart. Over a certain age is a higher risk of plaque, and it can be soft plaque. People nowadays are getting a lot of these cardiac calcium scores, which have a role in risk stratification, but not necessarily giving you the security. So basically, a normal cardiac calcium score doesn't mean that you're not at risk. What a calcium score does, it's a CAT scan that identifies plaque in your arteries by looking at the amount of calcium, because calcium binds to plaque. The higher the calcium score, the more plaque. But that's plaque that's been there for some time. It doesn't look at soft plaque. And so people can have a normal stress test, have soft plaque, which is formed from cholesterol, bad oxidized form of LDL, and it accumulates in the vessel walls. And what happens over time is you get a sort of a fibrous cap that covers that plaque, and then it becomes unstable. So sometimes these blockages that have been there for some time are really heavily calcified and don't necessarily rupture, but it's all about what we call the ruptured plaque theory, like a volcano. Something happens, it can be stress, smoking, uncontrolled high blood pressure, metabolic syndrome, where people aren't eating right, and it causes instability of that plaque where it ruptures and that cap breaks off, and now it releases what we call these aggregating factors, and platelets clot, and they go from having essentially like maybe a 10% blockage to a 90 to 100%, just like that. And that's when people suddenly have like the heart attack. So again, you could have normal blood flow to an artery, you can rupture a plaque, and it can go from 10% to 100%, just like this.
Yeah, well, that was a Quite brilliant explanation, Dr. Peter. Don't you think, by the way, Dr. Peter should be educating the whole of America, as you are right now? Because that was absolutely really very well said. Because the fact is that the heart is a fairly complicated organ. There's lots of different parts of the heart. There are the ventricles, there's the plumbing of the heart, and problems can occur in different places. Now, is it possible as well that all the plumbing, as it were, can be okay, but there could still be a massive electrical signal issue, which causes a sudden cardiac arrest that would be extremely difficult to pick up?
Yes. Well, again, talking about the heart as a house model. So with regards to electrical wiring of the heart, people can have fatal heart rhythms like ventricular tachycardia or ventricular fibrillation. Now, probably the most common cause of having these rhythms are people with weakened hearts or blockages in arteries. So people who have a reduced ejection fraction, which is a measure of your heart function, when it gets below a certain number, they're just prone to having spontaneous abnormal heart rhythms. And that's why you may know people out there who have defibrillators which are essentially shock boxes in your chest. They're like a pacemaker, but they can shock you. So really, the final common pathway for when people cardiac arrest is it's a plumbing issue that involves lack of blood supply to a heart muscle. And that lack of blood supply to the heart muscle causes heart muscle damage and causes abnormal circuitry of the heart and development of these fatal heart rhythms.
And that's when somebody just falls down.
Yes. So if you think about it, how it works is if the heart doesn't fully relax, it doesn't have time to fill. And so if you're in a really fast heart rhythm at the bottom chamber of your heart where it's going really fast or fibrillating, there's no forward movement of the heart, and that's just not compatible. And that's when people cardiac arrest.
I see. Okay. And speaking of shocking statistics or people needing to be shocked, Dr. Ben, what do you think would be good advice for anybody out there? Firstly, the fact that I know as a primary care doctor, you're seeing more of these types of cardiac events. What advice would you impart to people? And also, this is a big topic that we want to actually put in this podcast as well, what people nearby can do if somebody suddenly goes down, because you have a short window to actually rescue a catastrophic situation.
It's a great question. I think most people should be trained in CPR. You really should take the time to learn CPR. It absolutely saves lives. You can learn how to do it from multiple programs. The other thing is you can watch videos and take little courses how to use what's called an AED. They have those in most, I believe most stores and restaurants are required to keep them somewhere in the facility. So if somebody does go down, you start CPR, you call 911, and you have someone get you the AED. You can watch a video on how to put it. It's pretty self-explanatory once you get it out of the package. But if you're in a public setting, you get that, you put it on a person, you can really save a life, and it'll walk you through what to do. It starts speaking to you. The most important first thing you do, though, is you call 911, or you have somebody standing next to you call 911, and then begin CPR. Again, if you've trained in how to do CPR, this is so vital because it can save a person's life. God forbid it's a loved one, it could save a loved one's life.
That's such a good point, Ben. If you talked about most people who've gone through cardiac arrest and survived, the resuscitation that saved them wasn't necessarily emergency personnel, it was a bystander. And the story that I started off with, it was a bystander on the beach that actually resuscitated this gentleman. And if there wasn't resuscitation, there would not have been meaningful brain recovery, because that's what we always worry about is lack of blood supply to the brain as well if your heart is not pumping. And across the board, what I usually see in taking care of critically ill patients who have been through this, it's always been a bystander who just happened to be trained in CPR. And that's so important. And it really, you're talking about just an hour of your life going to a training course, which you could just save someone's life.
Yeah. Okay, everyone, I'm going to interrupt that awesome discussion for a moment to tell you about our expanding natural health and well-being store. We are very proud of our expanding store. We have natural immune inflammation support, bone support, memory support, heart support, sleep support, and our newly released premium organic lion's mane and organic chai mix. We've got some great reviews so far. Check in the links down below. ohighwellness.com if you're in the USA, North America, ohighwellness.co if you're in the UK, Europe. Also keep an eye out for our upcoming food and beverage products, including protein-thin snacks. All right, back to the discussion. If you learn nothing else from this show, the importance of knowing CPR, and it's more than just watching it in action. Actually go online and there's free videos available. So there really is no excuse. But the amount of times I have seen as a hospital doctor, somebody have a cardiac arrest, and usually they'll come in, they'll go through the emergency room, go to the intensive care unit, and then they'll come out to the hospital floor, which is when I see them. And I go back and I read the story, and there is a bystander who has started CPR, and that has literally made all the difference because it's happened within a few minutes and it's not difficult. Anybody can learn the basic techniques of how to administer high quality CPR. You want a good depth of compression, you want good rate after you call 911 or 999 if you're in the UK, and then you get right to work because that can help to maintain circulation to the brain. So I'd say those couple of minutes are literally the difference between somebody being permanently brain damaged and making a full recovery. I want to come back for a moment to the warning side. So obviously we're focusing here on somebody getting a clean bill of health and then having a catastrophic event happen. And everybody out there, again, has a story to tell. Once more, if you have any stories, please share them down below as long as you're comfortable. But would you say, Dr. Ben, that most of the time there is some risk factor there which has somehow been overlooked when this happens?
There's almost always a risk factor. So much of it is the lifestyle things that we talk about on this channel that you need to pay attention to. And usually there is something that a person's been kind of ignoring or not taking very seriously or not pushing hard enough. And you see it all the time. So sometimes we'll talk about this, but you'll get a cholesterol panel that was okay. Your blood pressure's been pretty well controlled, but there are other things, earlier signs of inflammation and insulin resistance that are actually leading toward this kind of condition much earlier than you might recognize. And that's where we've talked about other types of lab testing and things you should consider doing to protect yourself from this kind of event.
Yeah, insulin resistance, which I could talk for hours about. I won't do that. I'll be very brief because these two gentlemen think that I'm like an insulin resistance robot. But I'm talking about it for a reason, all joking aside, because I believe it's the number one pandemic facing the Western world, if I may use the word pandemic. I know that's usually used for infections, but in a way, this is kind of like a social contagion because we have so many people who've sadly, tragically fallen into bad lifestyle habits. And the classic tests like HbA1c or fasting glucose will be normal for years potentially, while insulin resistance is building up. That's why I'm a huge fan of checking a fasting insulin level, which sadly the medical establishment doesn't really know too much about right now. They're probably about 10 to 15 years behind. But you can check a fasting insulin level and calculate a HOMA-IR. I've made lots of videos about this before. I'll include a link down below. So a HOMA-IR. And the closer that is to 1, the more insulin sensitive anybody is and less likely they are to be inflamed. And then as it starts getting up to 2 and beyond, it starts to indicate significant insulin resistance, which of course is basically inflammation, and it correlates with body fat. And inflammation is one of the biggest risk factors, Dr. Peter, is it not, for a cardiac event if you're silently inflamed?
Yeah, well, I think it's one of the final common pathways. It's a culmination of events that are leading up to the cardiac arrest. And it's really, and you're right, Ben, it's subtle signs and you know your body best. And people don't always have classic chest pain. We know that that women are underdiagnosed with heart disease, have atypical symptoms, sometimes not classic chest pain. It can be jaw pain, shortness of breath, heartburn. Now, what I always tell patients, it's really exertional symptoms that you really, really want to be in tune with your body. So again, if you have exertional heartburn, it's not your classic heartburn, that could be a sign. But ultimately, inflammation does play such a key role because we talked about that ruptured plaque theory. Plaques rupture because of inflammation.
Yeah.
The plaques get irritated in some way from poor diet, lack of exercise, insulin resistance, and those plaques become unstable. It's the ruptured, unstable plaques that we always worry about the most. I think all of you out there, unfortunately, probably know someone, even starting into 50s and sometimes even people in their 40s, where they know someone that was doing well and just unfortunately dropped dead because of a sudden heart attack. And it was really just out of the blue. And it really is really disconcerting.
It is
Yeah.
devastating.
And I don't think we want to paint like a grim picture that there's nothing to do and to be worried out there, because there are things you can do. And much of our videos talk about things that you can do and be proactive as opposed to being reactive. You don't want to be the person to see a cardiologist after you've had a heart attack. You want to be the person to do all the things that we talk about: reduce inflammation, exercise, sleep. All those things are so important.
They are indeed. Yeah. Yeah, absolutely.
I do want to say we are talking about variants of the classic symptoms of heart disease. But I will tell you right now, the amount of times where I've seen a very healthy person that eats well, that exercises regularly, get into this kind of trouble is very rare. And actually, when it happens, it's something we all talk about. How did this happen? What's been going on? It is far more common to see somebody who never exercises, who eats a lot of processed food, who eats sugars regularly, get into this kind of situation. So if you're trying to protect yourself, the odds are with you if you do the lifestyle changes. Your odds of having a situation like this are far decreased. So there's quite a bit you could do. Quite a bit.
Oh, loads. Yeah.
And a lot of it isn't anything like far extreme. And I've talked about before, my patients who live well into 80s and 90s are doing really well. It's consistency. And it's not just, again, doing these things to make your doctor happy because you have an appointment coming up in a month, and you start eating better. You try to lose weight. You try to make sure you have the best numbers. You see your doctor, and then afterwards, there's probably a sense of relief. And then you maybe slowly slip back into your habits, where maybe not all that bad, but it's just consistency with good habits and moderation is what is, I think, a key to longevity.
Mm-hmm. Yes. And I can't tell you the number of times, and this is why it really almost makes me want to tear my hair out when people get told their HbA1c or fasting glucose is normal, because those are the standard medical establishment blood tests. But it's clear when you look at someone that they're in some bad habits, they have put on excess weight. If you're a man, body fat around the belly especially is a big sign of visceral fat deposition, which is a huge risk factor for heart disease. But a lot of the medical establishment tests don't pick that up. Having said that, we're not saying the tests are useless. Obviously, if somebody has a cholesterol number, usually, unless it's something genetic, which is sky high, it goes with insulin resistance, or their blood pressure is sky high. And a lot of people do get things picked up on stress tests. So we don't want to give an impression that these tests are useless. It's just that there are a lot of people who slip through the system, and we tend to remember those cases. Let's talk a little bit about toxins and the fact that there are various toxins in the environment, ranging from toxins which you can buy at a grocery store to toxins which are prescribed, often sadly, which can also affect the heart. Now let's talk about alcohol. This is an interesting one because I find, as I've talked about before, a lot of people with very mild to moderate consumption actually tend to be doing okay. But then a lot of people find mild consumption difficult. By the way, we have our vodka tonics right here that we're drinking. No, they're not vodka tonics. They're actually tea, organic chai. But all joking aside, alcohol, obviously it's a double-edged sword because a lot of people can't control their intake. I see a lot of people who drink excessively and have had cardiac events. Do you see that as well? I think it's a huge risk factor, and they might otherwise be in good shape, but they drink a lot.
Excessive alcohol consumption can be quite toxic on the heart. It can cause a condition called dilated cardiomyopathy. And what does that mean? It means the heart becomes quite dilated or enlarged and can lead to very severe symptoms. That can lead to arrhythmias, those conditions like Dr. Peter talked about, where you go into those terrible heart rhythms that are deadly. It doesn't have to cause the dilation to do that. It can just cause these arrhythmias in and of itself. It can increase your cholesterol significantly, and it can increase coronary artery disease. So excessive alcohol consumption, yes, can be very dangerous.
Excessive alcohol, you have to remember, is also disrupting sleep patterns. And sleep is a really, really big, important factor in reducing inflammation. That's when your body shuts down and reboots itself. Alcohol consumption, especially in moderate to heavy amounts, and you all out there will probably realize that you eat worse after you've been drinking or have had alcohol. And so there's nothing ever bad that comes from less alcohol, but it's a direct toxin to the heart. We always think it's a direct toxin to the liver. It's actually a direct toxin to most organs in the body, if you think about it. The brain, the heart, the liver, the kidneys,
It is. I mean, alcohol, ethanol is
It might be
toxic,
actually
but
one
then
of the,
obviously,
it might be one of the worst drugs out there if you think about it. If you think about other things that could have an effect on organs in the heart, but it really, it comes down to inflammation, and alcohol is a direct inflammatory agent.
It is. And what do you make, while we're on this topic, there are a lot of people, I've talked about this before, who use their drink evening cocktail. I mean, the late great queen of the United Kingdom was one of these who would drink a gin and tonic famously every day. And I talk to people over the age of 90 who will tell me that's my relaxation.
Yeah.
But the key is they can control it. They have one drink and that's it. But many people find it difficult to have one drink. So that's the issue. When does it become a poison to a therapy from being a therapeutic?
Yeah, I think it's when people start using it as a reward that they need to get through the day with. And I think that people who do really well and who live many years in really high quality, really functional lives, is they use it for socialization. And it's a time for them to connect. This really lovely older couple that used to have, they called it tea time, where they had martinis together. But it wasn't just about like getting the drinks and having multiple. They just had one and they moderated it. And I think the toughest thing is just, what is, and it's still subjective, of moderation of alcohol. Like what might be okay for someone is not going to be right for the other person. And I think that if you can't balance it out, that's where
That's a problem. Yes. And I do want to touch upon toxins. Now, lots of drugs out there are directly toxic to the heart. Many of the stronger drugs, many of the drugs that are used for chemotherapy. And I would have to mention in this particular podcast, we saw over the last few years concern about a particular type of injection which can induce transient cardiac inflammation, myocarditis. And I found it astonishing. And it was one of the most ridiculous things that I saw during the pandemic. And it's funny because we saw so many ridiculous things, but I actually saw doctors online arguing that something which can cause myocarditis and a troponin elevation wouldn't increase the risk of a heart attack. Now, obviously, if anything causes heart inflammation, whatever injection it is, it's going to increase the risk of heart attack. So this gets to the bigger point of knowing that whatever product you're consuming has been properly tested, that nothing is being concealed. And actually, coming back to that particular issue, I actually know of someone who was in their early 20s, completely healthy guy, who had the injection, and within 2 hours, he was in the emergency room with a troponin level. This is a heart enzyme, which was in the thousands directly from that. So the point is that anything that causes heart inflammation will increase the risk of a sudden cardiac event. The only question is that going to be catastrophic or not?
Yeah, or if it's self-induced and getting an injection, and but it's true. I mean, it is inflammation, and getting an injection causes inflammation in people. And I've seen as a cardiologist, and there's a reason why people have an uptick in fluttering or palpitations, awareness of the heart beating in their chest, atrial fibrillation, irregular heart rhythms, heart attacks. It's all linked to inflammation.
Yeah, that's right. And we see that even with certain chemotherapies, don't we, which are directly toxic to the heart.
Yeah, there are multiple well-known chemotherapy drugs that are quite toxic. Doxorubicin is a pretty famous one that can cause toxic effects to the heart. There are others that can certainly do that as well. Infections can, viruses can. I mean, there's quite a few things that can cause toxic effects on the heart.
Yeah, that's right. And I have to come back to that point because I just found it just a reflection of the clownish nature of the medical establishment. Again, during the pandemic, we had doctors actually arguing online. A lot of them argued with me that if a product caused inflammation of the heart, myocarditis, that it wouldn't cause heart attacks. Can you imagine saying that something which so inflames any organ isn't going to cause a problem? But we know that unfortunately large segments of our profession are a circus. That's why we're here. We want to be perfectly open and have transparent discussions that you won't hear anywhere else. And we even say we are down to earth. And if you think what we are saying is wrong, feel free to comment. That's okay. We are happy to debate. We think we're talking with logic and common sense. All of this is making me a bit stressed, actually, which is actually the last topic here. Stress, which is fairly ubiquitous these days. Dr. Peter, this is something that I know that you are big on stress and the heart. How many people have a stressful life event and then boom, have a heart attack? And then obviously tests could miss that.
It can. Well, we know there's certain phenomena in the body is just fascinating, and how stress can manifest itself. As growing up, I never really understood exactly the mental stress and physical stress and how well they're connected. And a perfect example is this, and you may know someone or may have had this, is something called toxins, which is also called broken heart syndrome, stress cardiomyopathy. And it's people who've been subject to some type of very intense stress, whether they're witness to someone passing away, intense grieving, sudden shock from something, and they get this surge of stress hormones, like a surge of sympathetic stress, cortisol, and the surge of stress hormones actually mimics a heart attack. And these people come into the emergency room. The electrocardiogram looks like they're having a heart attack. The troponin, which is a biomarker for the heart to detect a heart attack, is weight in the thousands. And they go have an angiogram and they have normal plumbing around the heart. And it's that surge of stress hormones can cause this. It's just it's really fascinating, unfortunate, but it just really underlies like how important it is to reduce stress. And you can't get rid of stress. I think the more important thing here is to learn how to manage stress better.
Yeah,
right.
Well said. And especially important over the age of 60, 65, because stress can affect anybody more at that age.
Oh, I couldn't agree more. I mean, the body-mind connection is extremely powerful. We did a prior episode where we talked about the importance of positive thinking. And a lot of that is to address this kind of scenario, to minimize stress, to see the world through kind of more positive eyes. Now, Dr. Peter's completely right. You cannot control the things that are going to come at you, the life events that are going to trigger you and kind of push you, but you can control how you handle, and you can control how you handle stress in general. And it's a good time to start right now practicing how to handle stress correctly.
Yeah, I always say 30 minutes a day to lower those cortisol and adrenaline levels, which are doing so much damage, and whatever works for you. I mean, for me, an intense workout at the gym, I feel $1 million afterwards, no matter how stressed I am at the end, come out sweating and I feel great. And that works for many people. But for you, maybe a walk in nature, maybe a comedy show, maybe spending time with a group of friends who make you laugh, maybe you meditate, but whatever you can do to lower those stress hormones. Something actually came to mind, and it's a saying that many of you probably have grown up hearing. Remember, people used to say, oh, don't do that because you're going to give that person a heart attack. Because everybody knew for a long time. It's like what you said, Dr. Ben, last week, an apple a day keeps a doctor away. I think the world had so much more common sense before the current medical paradigm where everything is all about big pharma, and we've forgotten all of these basic common sense things. So we will wrap up now. We hope that was helpful. The gist of this talk is basically trying to educate everybody out there that you can have completely normal tests, whether they're blood tests or whether they're more invasive tests. They look good. Your doctor will give you a clean bill of health, but there is a simmering volcano underneath. So we'll have closing statements. Dr. Ben, you want to go first?
Absolutely. I think one of the biggest things that we don't talk about enough in medicine and that doctors don't stress enough to you is know your body. You know your body better than anyone else. And if something feels off, it just feels weird. This hasn't been happening to me before, but it's happening now. Bring it up to your doctor. Don't wait. Give him a call. Say, this is really strange. It's just, I get this weird sore throat when I walk, or I get these weird headaches. Give your doctor a call. Let him know. Because maybe it's nothing. Maybe it's something that deserves getting checked out. You know your body, and you know when something feels wrong.
So true. And, there's been really a shift in heart attacks that I've seen in my career, is that we used to always just associate people who had heart attacks had high cholesterol. And now we're seeing people with normal cholesterol having heart attacks. And what it comes down to is we know it's not just about the low-fat diet. It's about reducing inflammation. And all the things we talked about really come down to that. So if you just be proactive, that's the best way of avoiding the things we talked about, but you really do know your body the best. So if you have a completely normal workup, but you are just feeling off, or if your symptoms accelerate, be your own advocate, seek emergency care, or seek a second opinion. We do that with lots of things. Our cars, when we go on road trips, we make sure that cars are working before we do that. But your body is your temple and you're the only one who really will truly care about the most. And so be your own advocate.
Very well said. Yes. And I will echo those statements from these two distinguished gentlemen next to me. And I will add as well that no medical test is 100% accurate. And all of you watching, I'm sure, are learning more and more about the areas where our healthcare system doesn't work and the things that it's not focused on. And the best thing that you can do is, again, coming back to knowing your own body and understanding that at the end of the day, this is a game of playing risk. Of course, unpredictable things can always happen. Everybody knows a story about somebody who was doing everything right and still had something happen to them, but it's all about tilting the odds in your favor. That's like anything anybody wants to do in life. You're trying to stack the deck in your favor to prevent something really catastrophic happen. So if you get a clean bill of health from your doctor, don't think that that means everything is okay, because in far too many people out there, millions upon millions of people, there is a simmering volcano. The standard medical tests don't detect a lot of the insulin resistance and inflammation. Stress tests are not 100% accurate by any stretch of the imagination. But if you sense that something is still wrong, then be persistent. You have to be persistent, like again, with anything in life, and really push and say, no, something is wrong. I need to take things a step further, maybe go for that heart catheterization, or really say that you don't think that everything is okay. You sense that you are not yourself. You're experiencing symptoms. A lot of people with cardiac complaints have an impending sense of doom. And that's something we learned in medical school. You have that sense that something is wrong. You don't feel good. You're climbing stairs. You're exercising. It's not how it used to be before. And that's a cry for help. And the good thing about living today, we talk a lot about the drawbacks, is the medical profession can do things today which couldn't be done 30 years ago. That things can be rescued even at a very advanced stage. So on that note, we say thank you very much for watching. We hope that was helpful. Keep going. Your success is our success, and we wish you the best. Do check in the links down below again for our separate Doctors of Ojai channel and our natural health and well-being store. We're very excited to be expanding that, all uniquely formulated wellness products, including our organic chai, which we're drinking and enjoying right now. Also check out our new ebook library as well on our website, ojaiwellness.com if you're in the USA, North America, ojaiwellness.co if you're in the UK, Europe. We will speak again next time.